Hi everybody, I'm Rolando Tomasini, Director of Partnerships for PATH here in Europe, and I'm here with our co-host Eric Piaget, Science Diplomacy Coordinator for EUTOPIA, an alliance of 10 universities across the European Union. His role centers on fostering scientific collaboration and innovation within the EU science and diplomacy landscape. Thank you, Eric, for having us today.
My greatest pleasure. Thank you for coming.
I'm also here with Maria Atiq, who's Second Secretary at the Embassy of Pakistan in the EU, Brussels and Luxembourg. Maria has accrued 3 years of experience in Brussels, during which she developed a strong expertise in the EU political environment and impact on third countries. Thank you, Maria, for joining us as well. And to my right, I have Agustin Martin. Agustin is a Senior Advocacy Officer at DSW with a background in political science. He's dedicated the past 7 years to advancing health policy initiatives within the Brussels health sector. Thank you, everybody, for joining us today. As you know, 2024 has been a super electoral year, with more than half of the population of the world affected by political changes. This naturally has consequences not only on the political trends and the economy, but also in public health, a topic that brings us all together here. So it is a very good time to pause and look around from our different angles and think, how has EU diplomacy affected global health in general, and what are the trends that we see from our different perspectives moving forward towards the next years? So to start, I would like to offer the floor to our co-host.
When it comes to diplomacy and the EU, one of the more guiding documents for EU's foreign policy is the global approach to research and innovation. It stresses an open as possible and closed as necessary approach, but it tries to facilitate the scientific research within the Union and mobilize it for soft power aspects. So you can really see health being used in that aspect. For example, when it comes to the Team Europe approach with developing these vaccine facilities in Senegal, or trying to make more equitable access to vaccines worldwide.
So I think that this situation now calls for increased efforts, increased interaction, and increased diplomacy with different EU stakeholders. So that we keep on convincing them that health is another important area which is of paramount importance, and security and health are not mutually exclusive. They are both equally important, and you cannot get away with something to focus on your attention on something else.
The securitization agenda, that's certainly one of the big changes. It comes to some extent because of COVID-19, of course, and the focus on global health security, and then it was to some extent increased by the Russia's invasion of Ukraine, and the fact that now we have security as one of the pillars of foreign policy in the EU, and calls to increase defense spending as well. This is going to have impact across policies, including for health and including for research. And I think to some extent this is going to also change the way the EU operates internationally, because up until now, the EU's external action, actually, or everything that has to do with EU actions beyond our borders, which includes domestic policy with an international dimension like research, it used to be based on consensus, and it used to be based on the kind of evidenced. Now this is, we're seeing a detachment from that approach, which is linked to the rise on the far right and mostly on populism. I mean, Viktor Orban's now tour through countries, basically bypassing the High Representative for Foreign Affairs, President of the Commission, in its in representing the EU. This is one clear example. Also, the increase in far right members of in the parliament. Far rights are also notorious anti-science and skeptic about vaccines and other priority interventions for health. So this is going to have certainly an impact, again, across areas, but notably for health and research.
What is the role of the EU as a global health actor, as opposed to other more traditional who have been involved in one particular science area?
I can maybe just say that, we typically look at the impact of organizations by the amount of funding they put into those areas. I mean, if you put it in perspective to the size of the EU budget, the EU is certainly allocating a very big chunk of its budget into global health and research and innovation for health matters. We talked about the instruments that it has, unique instruments like the EDCTP, but also EU Medicines for All, which is a regulatory toolkit that the EU has to fast-track the approval of medicines outside of the EU. So the EU certainly punches beyond its weight in terms of its budget. And it also does something quite important, which has been captured in this wonderful book from Anna Bradford called The Brussels Effect, which is basically regulating many of these standards on international trade, including in health, including in chemicals, environmental standards, etc., and now on issues very close to our heart, like artificial intelligence, which holds a lot of potential, for example, to revolutionize medicine R&D, but also can be quite problematic and disruptive. So I think the EU is certainly a regulatory superpower, and is helping to push those standards on those safety, environmental, and quality, criteria up.
Yeah.
So it is something that should not be really neglected, and is an important reason just to engage with the EU, because it's setting, the rules for the rest of the world in priority areas.
When it comes to partners beyond Europe, when it comes to research, I mean, there's so many affiliate countries associated with Horizon projects, and I know Pakistan is one of the biggest non-EU countries that is affiliated with Horizon projects, and I mean, it just shows its commitment to building bridges through research and science, and I mean, some of these have also a health dimension to them. And then when it comes to climate policies, I mean, EU is very much leading the way, and obviously I won't go into the connections that bad climate has on health, but I mean, that is also a strong implications for global health.
What is different about the EU in health? I mean, if you, from a diplomatic perspective, you're focusing on health diplomacy. What would you say to the colleagues, but also why the EU? What can they achieve with the EU that they cannot achieve with somebody else?
But yeah, we're at a very a crossroads right now, because at the moment there's an unprecedented amount of conflict going on, but at the same time the amount of challenges that we face that are of a scientific nature are also becoming existential, from climate change to pandemics to the proliferation of artificial intelligence. All of these require regulatory frameworks for mitigating and addressing the risks that they pose. And I think the EU, by even though it's a very kind of daunting bureaucratic beast at times, it does have that ability to kind of bring many voices around and develop regulatory frameworks for very complex issues. But yes, I mean, the EU's background, from when it was established after the Second World War until recently, has always been a normative power. It hasn't needed a military. It hasn't really relied on these hard power aspects. It's always used its soft power as its main sort of tool. But now, when we're seeing all of these defense procurements and talks about getting a new EU military, a lot of that normative power is being replaced by this more hard power metrics. And then I think I would just like to mention EUTOPIA and many universities.
Great example of European collaboration.
Exactly,
and
that
yes.
Where I think we still sort of uphold these normative values of Europe.
For those of our colleagues who are not as familiar with the EU, can you cite a few success stories that in your experience here in Brussels you've seen this work and the EU made a difference? Because
well, I mean, I remember we were one of the few NGOs that started very early advocating for the EU to support the Africa CDC when it was created in 2016, and the African Medicines Agency, which was kind of recently established, and that PAF played a big role also on that. And we're happy that it's finally happened, but it had to go. We had to go through a pandemic and a lot of stress and drama in order to see that change. Right before the pandemic, and even at the beginning of the pandemic, nobody had really didn't even knew that there was an Africa Center for Disease Control, right? So it's and then of course now you have a partnerships between Africa CDC and HERA, between Africa CDC and CEPI. Funding going straight, an EU innovation agenda that has public health at its core. So there's so much, and of course Team Europe initiatives on health and EDCTP. So there's a lot that has moved in a very short span.
I would like to come back to you, Eric, in terms of you see the EU through its diplomatic mechanisms has reshaped proactively and reactively, more than proactive, to all these different crises. What do you see now? Do you see the governance or the at risk, or do you see that we are moving towards, with this security mindset, towards something that would really reflect the needs of the future?
At first, it's always been a bit reactionary to it. Obviously, when Ukraine was invaded, and then there was this sort of blanket sanctions, cutting all sort of scientific cooperation, even if it didn't have a political dimension to it. For example, up in the Arctic, 30 years of cooperation up in the Arctic was suspended. Indeed, I think that was all a bit of a knee-jerk reaction. But since for the past year, the European Commission has been developing the EU framework for science diplomacy. And right now it's still sort of in the working group phase. There are 5 working groups, and they're actually just wrapping up right now, make each working group dealing with things such as capacity building or the role of embassies when it comes to science diplomacy. Each of these working groups will develop a report, and then the synthesis of these reports will come into place in the autumn, around September or October, and then that will become a policy document that will be expected to be voted on by the Danish presidency.
The thing is that till 2021, because of the COVID pandemic, we know that all the EU stakeholders across the spectrum were very much focused on public health. And then we saw various concerted efforts being undertaken by the EU to prevent the population from the harmful effects of COVID. However, unfortunately, after the Ukraine war, the paradigm has shifted and the focus is now on security. And this is something that has reverberated throughout the electoral campaign of different MEPs across the European Union member states. So when you are basically concerned about your security more, then unfortunately health, environment and climate change automatically take a backseat. This is something that has been observed where the largest party of the European Parliament, which is the European People's Party, and the party which was the proponent of the Green Deal, was itself never talking about it throughout the election campaign.
So let me just come back for a question to you. As we see this political trend, not only in the EU, but globally existing, what do you see as the role of institutions like ours? I mean, there's, on the university side, there's the research, there's the NGOs also who are working on health, and also countries who are looking at the development cooperation. Is there, what would be your call to action for actors like us in the light of these political trends?
I think we need to remind the EU that what it has achieved, in this field. I mean, we are primarily looking at the global health dimension of health, so mostly international dimension of public health, but also research and innovation into global health. I mean, the EU has stupendous initiatives in this field, most notably the Global Health EDCTP3 joint undertaking. This is the largest and oldest partnership with the African continent. There's more than half of African countries are part of it, more than half of European Union members are part of it. It's a 20-year-old partnership that has managed to develop groundbreaking technologies like the 2 first ever malaria vaccines, one of those developed by PATH, the first one. So, I mean, this is delivering very, very concrete, impactful solutions to some of these challenges. And we should be proud of this, and we should really remind that the EU is delivering in this field. But also that this is a very fragile field. I mean, we are again back to pre-pandemic discussions where the Commission is even considering to scrap DG Sante or split it into 2 units. The health program is not guaranteed to continue. So we seem to have forgotten all that we've learned in the COVID times. And when you look at the history of the EU and what it does in health, it never really behaves proactively. It's always as a result of a crisis. Right. I mean, the ECDC was created as a result of SARS-CoV 2002 epidemic. The HERA, new EU Pandemic Preparedness Agency, is a result of COVID-19. Even the EDCTP was created to some extent as a result of the HIV pandemic. So what we need to really try to improve in this new cycle is to be more proactive. We know what are the challenges ahead, pandemic-related, antimicrobial resistance, there's still global health inequities. We just need to kind of,
You raised a point, and then I would like to go back to you, Maria, on this one of the role of embassies. And I think for many of our colleagues, both at PATH but also in the health sector in general, very often, especially from a scientific or operational background, are looking at solutions. How do I implement this? How do I address this issue that I see in the global health sector? And then they see the embassies here on one side, beyond the fence, and they see the EU Commission in the country. But it's still for them undefined. How do I approach? Why should I talk to an embassy? Why should I involve? Why should I take the diplomatic route to find these solutions?
I believe that embassies are of the third countries, and if you look at the member states, they have their permanent representations. And I believe that in the EU system or architecture, the working parties of any permanent representation are basically the actual grassroots level, where the main deliberations are undertaken, where the policy dialogue takes place, and from that is a place where you get to know that whether any possible future policy will get through or not. What is the opinion of the member states on that? So basically, I would like to emphasize the importance of member states of EU and their permanent representations, and more specifically, the working party of the European Council on Health, of which all member states are part of. And I think that it is increasingly important for people working in the public health sector to reach out to them, because those people have a say in the system. The commission comes up with a work plan for you, a proposal for you, but these people sitting in the working parties have the ability to scuttle a project or to make it go through. And they can also be your voice in the system, direct voice. Because when you talk about the European Parliament, okay, you have 720 MEPs, and you have let's suppose a committee on health, and in the end the process is something like that the proposal comes in the end to the Parliament. But if you target rightly the member states, you will even be able to know that how much is the budget, or maybe you can say that this particular clause is not appropriate, it's not realistic, it's not in congruence with the ground realities.
Correct.
This area lacks funding, this area lacks more funding. So if you align yourselves with certain member states who have a bigger say in the system, then I think that you can easily make inroads in the system and get yourself heard.
When you see solutions that are coming down the pipeline that will change the landscape nationally, but where does diplomacy and the interaction with the EU help in that process?
I think it can help a lot, because in the EU system, the good thing is that they're ready to listen to you. So the appetite is there, they are open to new ideas and new opinions. So if you keep on interacting with them, as I said earlier, with people who are aware of your subject, your area, and who represent diverse specifications of this public health sector, then I think it can really help you, because we have had this experience of interacting with EU stakeholders when it came to trade policy instruments, etc. And we realized that they are very basically forthcoming people, and they are always interested in knowing that the people who are operating on ground, who are the direct beneficiaries, what they have to say about it.
In the European Union, it really there's I think quite a robust consensus about the utility of open science. Because if you look from a vaccine perspective, during the COVID crisis, the amount of open source publications it grew. Many fire or paywalls were lifted, and because of that amount of open research, I think that they were able to decode the genome of the coronavirus in an unprecedentedly short amount of time, in 3 days. And that, I think, is just one example of what comes with openness.
I think all of these leaves us with a lot of optimism towards what's to come, even though a lot of changes are still to settle down. So we'll have to see the evolution of this as we engage in more discussions and how the political trends will affect the health agenda. So I really want to thank you all for this session, and I know this is a continuing discussion that we will have not only with you, but also with those of you watching us, as there will be other sessions like this, not only online, but offline, where we could have further discussion. Thank you.